Hello, welcome. I'm Obielo Blessing the Safety Nurse. This is your go-to place for everything in women's health. So we've been carrying out a campaign concerning women's health, everything from reproductive health to mental health and other aspects of health. Today is not going to be different. We're talking about something very important. Have you ever wondered why you have irregular periods? Maybe your period comes this month and the next month no blood, no spotting, nothing. Or you may see your period this month and then for the next month it takes almost double the time. Or you may see your period this month and for the next month your period lasts sometimes up to like 14 days. You're not alone. Today we're going to be talking about irregular periods and everything around it. I'm so excited, so stay tuned. Let's define irregular periods. Starting with the definition of irregular periods first. So, irregular periods last averagely 21 to 35 days. That is a regular menstrual cycle length. But when you begin to experience your periods lasting more than the average number of days, let's say your period lasts and your cycle lasts 35 days. So if you have issues calculating your cycle, there's a video I did concerning calculating your cycle. You can go through that. So imagine you have a 35-day cycle, and for the next month it goes down to 40 days. Next month you're having 45. It means your period is irregular. Okay, so imagine also there's another instance now. Maybe you see your period this month and the next month you don't see your period for the next 3 months or so. You're also having an irregular period. So it's either you're having missed periods, you're having longer cycles, or you're having no periods at all. That's all irregular periods. So what's the cause of an irregular period? So now let's talk about some common causes of irregular cycles or irregular periods. Number 1, hormonal imbalance. So I did a comprehensive video on hormonal imbalance, but an explanation to this is that hormones are chemical messengers in your body, and they have a role they play in the reproductive system. So if there's too little or too much of a certain hormone, either you have estrogen, progesterone, it can affect your menstrual period and affect the regularity of your periods. This can be due to different health conditions like PCOS or endometritis or any other thyroid diseases. Number 2 is stress. When you're stressed, your body releases a hormone called cortisol, and cortisol messes up the hormonal system. It affects other hormones like estrogen and progesterone, which can now lead to an irregular period. So you may notice that for that month you may not see your period, or you may come late. Next is weight gain or weight loss. So certain sudden weight gain or weight loss can affect your body system, thereby affecting your periods. So if you add up weight within a short period, just quickly, or you lose weight within that period, there's possibility that your cycle has to adjust. So you may experience either a delay, which may look like an irregular period. Number 4 is also one that we always know. It may be a health condition. Yes, irregular periods can be the result of a health condition. As I mentioned PCOS before, it can affect your hormones, leading to short periods or even delayed or no periods at all. So that cause may be birth control medications. So if you've been taking any form of birth control medications, like maybe the injectables or even copper T, you may have to take some maybe have to be patient for your body to adjust. So when you stop these medications, your body may need some time to adjust before you begin to see your period regularly. So within that period you may experience irregular menstrual periods or menstrual flows. Another cause, this is going to be the 4th one, yes, is weight gain. So when you suddenly increase weight or you suddenly lose weight, your body still needs to adjust. So within that period you may have irregular flows, and you should understand that that's absolutely normal. Your body is taking time to readjust to the weight gain or loss. Another one is pregnancy. Yes, so if you are pregnant, you miss your period. The periods may stop your periods will stop. Let's say that. So if you're pregnant, you will not see your periods. That's one of the cause of irregular periods. Or if you have given birth and you're breastfeeding, this can affect your menstrual cycle. So you may have, maybe your menstrual cycle may stop for like 6 months. Some people it extends to even a year. So that's absolutely normal. But if it extends beyond that, then you need to go to see your doctor. So those are some causes of irregular flows. There's one more cause I'm going to be mentioning, which is perimenopause. Menopause in women comes with a varied and different kinds of symptoms and experiences, and one of these is irregular periods. So perimenopause has been defined as 7 years before the cessation of your periods. That's menopause. So it can be 7 to 10 years, and the average menstruation or menstrual the average age for menopause is 45. So this may be 7 years before. So if you're getting closer to menopause, you may begin to experience irregular flows, irregular periods, which is just showing the close of the cycle. So those are the causes of irregular periods. Most times, occasional irregular cycles or irregular periods can be normal, but there are 3 things to note. If you see any of these 3, you experience any of these 3, you need to see your doctor immediately. 1, if your period ceases for up to 3 months, hospital. Number 2, if you experience intense pain, you're feeling pain during your periods, or it may cease and then when you're seeing your periods there's intense pain and heavy bleeding, please go to the hospital. We always talk about the natural way to take care of these things. So the natural way to help deal with irregular periods is stress. Make sure you manage stress. You can look for things that will help you to manage stress, maybe meditation, yoga. It can be also spending time with family, relaxing, having time to calm down. Just make sure you're not getting the cortisol levels too high. So that's a good way to deal with irregular periods. Number 2 is balanced diet. As a woman, your diet is very important. It's what goes into you and it plays a role even in your periods. So can you get rid of all those toxic foods, those sugary foods? You can take them in moderation. You take them, do not just avoid them completely, but can you reduce the levels and balance it with a healthy diet? Next point, exercise moderately. We're in a period where we're having increased levels of obesity and all of that because of most of us are living sedentary lives. Yes, you have so much screen time and less time for other activities. So take out time to exercise. It can be just moderate exercise. Just take a brisk walk around. Have time to exercise. Next point is to ensure you get enough sleep. I can't overemphasize the importance of sleep. If you can get 7 hours of sleep, that's beneficial. That's good. It's good for your body to give your body time to reset, give your hormones time to reset. It's very important. Maintain a healthy weight. It's not easy most times, especially when you have genetic tendencies to add weight and you found yourself trying to lose weight. It's been very difficult, but as much as you can, as much as it depends on you, try to maintain a healthy weight. You can work on your diet. Just lose some of those calories. It's very important. Lose some of those excessive calories for the sake of your health. That little or slight changes in your cycle may be normal because our bodies differ. It may be delayed because of stress, yes, lack of sleep, and all those things we mentioned. But if you notice that this is getting extreme, remember to see your doctor. Visit your doctor and have a full check. Woman, your health is your wealth. So before we meet next time, I would love you to like, to subscribe, and follow us. If you have any other questions, you can drop them in the comment section. Till we meet next time, remember to stay healthy.